Life is about shedding the darkness and embracing the light of knowledge. So let's get together and awaken our minds. Friends, welcome to the series of videos of Awakening the Mind. My name is Dr.Aakash Ahuja and I'm a psychiatrist here in Los Angeles, California. I did my medical school from Maulana Azad Medical College in New Delhi, India, and I did my residency training in psychiatry from Hennepin Regents program in Minneapolis, Minnesota, which is a state in the United States. Today we'll be talking about substance abuse or substance dependence or alcohol dependence in detail. If you look around yourself, you will notice so many people who do abuse some kind of drugs or smoke cigarettes or drink alcohol. So my thought was to talk about and educate and learn along with you many drugs which people do use, and then talk about alcohol dependence in detail. So let's talk about some of the drugs which people do use around the world and also in India. I'll be referring to the slides which I have made, and you guys can review the slides at the end of the presentation. So the types of drug abuse can be classified into actually one which is stimulants, and one which is kind of downers, kind of depressants. Stimulants are more like party drugs, and people take it to get high energy, and they don't sleep when they use it, and they hallucinate, and they see things and they hear things, and they just become like party animals. And some of those drugs are crack, cocaine, amphetamine type stimulants, PCP, and actually nicotine. Even though it's a milder form, but it's still a stimulant. Most of these drugs, apart from nicotine, which can be used as cigarette, pipe, hookah, tobacco chewing, are basically illegal. Now let's talk about the drugs which are downers. We have charas, marijuana, heroin, brown sugar, and all these are illegal drugs except for alcohol, which is also a depressant. As I mentioned, let's talk about alcohol dependence in detail. So what causes alcohol dependence? Again, there are so many theories, there are so many factors, but the research has shown that basically the causes can be hereditary. So if a father is an alcoholic, then the son has higher chances, higher propensity to become an alcoholic. It's also genetic. Some people are born with certain genes which make them more susceptible to become alcoholics, and also it's due to a neurochemical in the brain. Actually, a lot of chemicals can affect, but there is a particular neurochemical receptor known as GABA receptor, and that when people drink alcohol, that GABA receptor actually gets stimulated, and when it gets stimulated, it basically tries to relax the brain or try to relax the body, or at least that's how we perceive it. And that is the pleasure which the body and the mind gets, and that's the reason that people drink more and more and more of alcohol. Talking about more and more alcohol, let's discuss two particular phenomena which are very important related to alcohol and some other drugs also. One is known as tolerance, and another known as physical or physiological dependence. So what is tolerance? I'll just give you an example. So let's say somebody drinks two shots of alcohol or two beers, and that gives them some pleasure. That gives them a pleasure maybe from here to here, this much. And if they continue to drink that two shots of alcohol, then actually they might not feel that much pleasure. The GABA receptors in them might not get that much stimulated, that much activated. So if they were enjoying from here to here, now with two shots, they might enjoy only this much. So that's a big problem for them, because their GABA and them, they want to enjoy more. So what they do is they will drink more. They will drink 3 shots, 4 shots, even a bottle of alcohol, so that they can still get this much effect. Now this is known as tolerance. This also leads to physiological dependence. Among so many drugs, actually, alcohol is one which can cause severe physiological dependence. And not only our brain, not only our GABA receptors, but the body becomes dependent. Alcohol does not just affect the liver, kidney, nerves. It can affect all other areas, and it can affect the memory, and it has severe withdrawal effect. People can get severe seizures. They can start having hallucinations. They can see like white elephants on the wall, and there are many cases where people have died because of alcohol intoxication as well as alcohol withdrawal. Again, alcohol is one of those drugs which causes a severe physiological reaction to the body. Moving ahead, guys, who is at risk? It's such an important aspect to know. Again, we should not just consider that okay, if Dr. Ahuja has said, that's me, has said that we don't belong to this list, so we are not at risk. That actually is not what I'm trying to say. What I'm trying to say is that this risk include some of the folks who might be more at risk for developing alcohol dependence. So let's go through that. So if you are a young adult under peer pressure, I mean, your friends drink alcohol and you go out after work with them, you might be at a higher risk. If you have stress, depression, anxiety, or PTSD, which is post-traumatic stress disorder, you are definitely at a higher risk than a general population to become alcoholic. If you have easy access to alcohol, in certain communities, in certain countries, certain states, alcohol is more easy to obtain, and that can definitely increase the chance as compared to if you don't have the easy access. If you have lower self-esteem, and if you have problems with relationships, if there is a family problem, problem with the spouse, problem with kids, and other factors, problem with your boss, these things which are very stressful can sometimes lead people towards drinking alcohol as a way of running away from the problem. If some people live a very stressful lifestyle, and also if people live in a culture where alcohol is very commonly used and actually is not considered a taboo, in those cultures alcohol dependence can become slightly more common than not. So how to diagnose the alcohol dependence? There are many ways we can diagnose alcohol dependence, and of course a psychiatrist or a physician is the best person to do that. But there are some questionnaires, some questions which people can ask themselves, and if they answer yes to all of them, then they should really be concerned that yes, they can have alcohol dependence. So this questionnaire is known as CAGE, CAGE, and every word, every letter is associated with a question. So C is cut. So if people have tried to cut the use of alcohol, that's number one. Number two is A for anger. If people get angry, if somebody tells them not to drink alcohol or drink less alcohol, then that's number two. Number three is G for guilty. If people feel guilty when they drink alcohol, or they think that, well, you know what, I shouldn't have drank that much alcohol, or maybe I will not drink it next time. That's number three, guilty. And number four is E as an eye opener. If people's body becomes so much dependent and that they need to have a shot of alcohol in the morning to basically open their eye, like an eye opener, so that's number four. If people fulfill these criteria, then most likely they do have alcohol dependence. Let's talk about the treatment for alcohol dependence. The first step is to basically get an evaluation done by a psychiatrist or a physician. But if somebody is acutely intoxicated with alcohol at that particular time, maybe an evaluation might not be the best way to go. The best way at that time would be to take the people to alcohol detoxification center. And what they do is they make sure that they give people some drugs and they detoxify the system, their body, so that it does not have any alcohol. It's an inpatient place where they do this alcohol detoxification, and we have many in different parts of the country. After that, then it's the responsibility of the person who is suffering from this illness to maintain the sobriety by joining different groups like Alcohol Anonymous, also known as AA groups, and these are usually again present in many areas of the country and have shown in research a lot of good potential to maintain to help people maintaining their sobriety. There are many drugs which a psychiatrist can prescribe also, which can decrease the relapse for using alcohol. And some of the drugs I will mention are acamprosate. That's a drug which has been shown to lower the relapse rate in people who are dependent on alcohol. Then there is disulfiram. Disulfiram produces very unpleasant effect if somebody drinks alcohol because they are having craving of alcohol. So what it does is that it does not give people that pleasure of drinking alcohol. It does not stimulate the GABA receptors the way it used to be. So it basically takes away the reason to drink the alcohol. That fun, that enjoyment is taken away. So that's how disulfiram acts. Other medication is naltrexone. What that does is basically decreases the alcohol craving. So now the GABA receptors of the person, they are not asking for the alcohol anymore. So if they're not asking for alcohol anymore, then the person has again no reason to drink alcohol. So I basically explained in simple language as to how these drugs work. And again, along with AA meetings, along with yoga, hypnosis, therapy, and family support, which is extremely important. Spousal support, support of the kids, support of the boss, support of the society. We can definitely get a victory over this severe illness and save a person's life. Thank you for watching this video.